Thank you for joining us today and welcome to our first installment in the Resource and Wellness series on the topic of engagement in medication taking in collaboration with the American Diabetes Association. My name is Dr. Dan Corboy and I'm the Medical Director of Illinois Medicaid for Humana. My clinical team and I provide oversight of the care management of our members who are part of the Illinois Medicare-Medicaid Alignment Initiative. This initiative, also known as MMAI for short, is a health plan program for people who are dually eligible for Medicare and Medicaid. MMAI is a voluntary program that improves health care for patients in Illinois and allows them to receive all their health care services through one health plan. In order to be eligible for the program, a beneficiary must be enrolled in both Medicare and Medicaid. Currently, MMAI is only available in Chicagoland and Central Illinois counties. However, the program will be expanding statewide on July 1st, 2021. As we look towards that expansion, we strive to be present in the community to break down barriers in communication between members, community groups, provider groups, and managed care organizations. Our goal is to decrease confusion and provide services in order to best serve our new members. The Resource and Wellness series with the American Diabetes Association will bring live interactive webcasts throughout Illinois. Quarterly, Humana and ADA content experts will host a webinar focusing on a range of topics. All live sessions and online resources will be recorded and available in a virtual library for access and continued learning by members at their discretion. Please join us for future topics as well, including controlling A1C, nutrition and meal planning, and meditation and stress management. Thank you.
Great. Well, welcome everybody. I am super excited today to kick off this discussion. We have some excellent panelists. So my name is Amisha Walia. I am an endocrinologist at Northwestern University Feinberg School of Medicine, and I see a large group of diabetes patients from all around the Chicago area. And we have two amazing panelists that are joining us today. First is, I will ask them to introduce themselves, and I will give a brief background. First, Amy Hess-Fischel is a dietitian and diabetes educator who's been working at the University of Chicago Kovler Diabetes Center for the past 13 years and has worked with all ages of people with diabetes. So Amy, would you like to kind of give a background on yourself to everyone?
Of course. Hi, everybody. Thanks so much for being with us today on this sunny day in the Chicagoland area. That's a rare treat for all of us. But I, as I said, again, working with people with diabetes for over 20 years and doing diabetes education, diabetes self-management education. So it's been such a pleasure to be able to help people like all of you to be able to navigate your diabetes experience and your journey. So it's so nice to be able to be here today and chat with all of you.
Thank you. Thanks so much. And then I would like to introduce Sheila Harman. Sheila Harman has been a registered nurse for over 30 years and a certified diabetes care and education specialist for over 13 years. She's an advanced practice nurse, clinical nurse specialist, and is currently the director of provider practice at University of Illinois Mile Square Office of Community Engagement and Neighborhoods Health Partnership, school-based health centers. Sheila, welcome. Do you want to give a further introduction, background on what you do?
Thank you. And again, welcome everyone. We're so excited to have you be a part of this program. Yeah, I always share my story. I have type 2 diabetes as well. And so I teach, I educate, I speak wherever I can. My mom has diabetes, my siblings, out of all 7 of my siblings, 6 has diabetes and 2 have died from complications of diabetes. And so I try to be able to share my story as I help patients as well understand why we have to take control of this disease. So not only am I'm educating and helping others, but these are things that I have to do myself as well. So I'm happy to be here and a part of this panel. So thank you for inviting me.
Thank you. So I would like to note that both of you have exercise equipment in the background. So we will perhaps not be talking about exercise today. We are going to be talking about medication adherence. However, we do like to talk about the word in a broader sense, really talking about engagement, participation, involvement, and then really specifically actually medication taking. And so, I think for the remainder of this conversation, we're really going to wrap around those words and those topics to specifically talk about how we engage and how we can really participate and stay involved, whether you are a provider or whether you are a patient or whether you are a loved one of someone with diabetes. So to kick off our conversation, we have a few basic rules. So microphones should remain mute during the presentation. Please feel free to use the chat feature located in your Zoom toolbar if you would like to ask questions or make comments. And following the presentation, we will definitely take several minutes to take your questions. I think this is really important, and we really want to make this interactive. That will be a huge part of what we want to do today. And we will also, this is supposed to be a conversation, and so we'll be monitoring the chat, and as things come up, we would love to I'll try to direct those questions or those comments before the question answer period if it seems like it's flowing with the conversation, really add value at that time. So, to kick off the conversation, I'm involved with 2 long-term studies with type 1 and type 2 diabetes. One is the EDIC study, and the other one is the Diabetes Prevention Program Outcome Study. And both essentially have shown in different ways that, decreasing A1C to a certain value, less than 7 for some patients. For some patients, it might be slightly higher, is really beneficial for a multitude of reasons, specifically related to complications, which we're all worried about, right? So complications of diabetes can include eye disease, kidney disease, neuropathy, as well as cardiovascular risks like stroke and heart attack. And so what we really want to engage in our conversation today is how do we, help as a group, in terms of a shared decision-making model, or coming together to make sure that for everyone, we're really addressing holistically their medications, and also specifically engagement and participation to bringing that A1C down. Sheila, Amy, I think also the other thing is we're all going to go by first names, myself included. So if you guys are okay with it. So, let's talk about, why you guys, when you're talking to your patients, why do you think it's so important to manage your health and diabetes, and what do you counsel your patients about, if what can happen if you are not able to engage and get your diabetes under control, and also not able to take medications or have barriers to being able to get your medications, et cetera, to bring that A1C down.
Sheila, did you want to start, or did you want me to kick off?
Either way, I can kind of talk about just getting them prepared. So thank you, Amy. So one of the things I always start with the patients is kind of talking about how to prepare for their office visits? What things do they need to do to be prepared when they go in for their office visit? Because of course we want them to understand that, we want you to take control of the disease before it takes control of you. We want to talk about the complications that occur when diabetes is not managed in the best way possible. And so one of the things that I talk to the patients about is, what you want from the visit. So when you're going in to see your provider, whether it's a doctor, it's a nurse practitioner, whether you're going in to see one of the diabetes specialists, you want to tell your story. You want to be heard. You want them to know, information about yourself. You want them to know what you're experiencing, how you want to feel, what kind of things do you think you need from the team to help you feel better. And so when you go into the provider's visit, also, we want to be able to say the provider wants to hear your story. They want you to give any updated information that you have about yourself. We want to hear about what things are allowing you to adhere to a healthy eating pattern or being able to take your medications as prescribed. We want to know anything that you're feeling. We want to review any side effects that you think you're having, even if it's little or you think it's minor. We want you to write these things down because we are here to be your partner in this journey. We're here with you to support you. We are your coach. You are the center of everything that we're trying to do. So some of the things that I do, I have the patients and I tell them, take a notepad with you and take someone with you if you can. And if you can't take someone with you, have them available by phone so that way they can call in. And while you're listening to your healthcare provider talk, they can take notes for you because there might be something that you missed. And so when you go in, you want to talk about any symptoms that you're having, whether it's related to if you take the medication, if it's related to certain foods. We want you to be able to tell us a little bit about yourself and what has been happening since the last time we saw you. And so we want you to make little notes in a notebook so when you go, you can have those things readily accessible. We're going to be, I always teach patients, we say discuss, debate, and decide. We want to discuss what's going on. Debating is having a conversation of what's going to work best for you, and then helping the patient make an informed decision about the best things that they can do to be able to manage their diabetes in the best possible way. And so that's what we call the 3Ds, to discuss, debate, and decide, so that way you go prepared, have a notebook so you can take notes or have someone taking the notes for you. Or again, I encourage them, do you have someone that you want to call that they can just listen in and take notes for you so that you can talk about it once you leave and you get home? And so those are some of the things that I do in getting them prepared for the visit, whoever they're seeing, so that way it can make the visit, some providers' office, we might have a 15-minute visit, we might be a 20-minute visit, 30 minutes. It just depends on how that visit template is set up. And I just make sure that the patients understand that, right? And we want them to maximize their visit by going in being ready so that they can have the conversations and have the discussions so that the healthcare team can best work with them to help meet their needs, to make sure that once they leave, they understand what the plan is, because you should be a part of that plan. You should be included because, again, this is patient-centered care. So we want to have a plan, but we want you to have input in what that plan should look like. Amy, I don't know if you want to add anything or go from there.
Yeah, no. Thanks, Sheila. Again, you hit the nail on the head when you said, patient or person-centered care. Again, gone are the days, folks, of, again, the doctor is, yelling at you for what you did wrong, or you're afraid to talk about what's happening. Again, it's all about you now. And it's really important that you all remember that and understand that, again, your visits, you're the customer. The customer's always right. You're the one that goes in and says, this is what I need to talk about. So don't be afraid to talk about things that are troubling you, things that are causing concern. Again, of course, the whole conversation today is about medications and why are people not able to take them? Be very honest in those discussions. And, as a diabetes educator, now we used to be called diabetes educators, now we're called diabetes care and education specialists, but again, we're one and the same. We are so lucky that we are able to have much longer time frames with all of you. So again, remember that you do have the ability to have diabetes education visits that are covered. It's a covered benefit through Humana. So it's just something that I wanted to point out in case you didn't know. But we have 30, 60-minute time slots that we sometimes have to be able to meet with folks about their diabetes. And we can really kind of dig in and talk about what's really happening and what are the problems. Because again, we all know that doctors, nurse practitioners, they're overworked. They see, as Sheila said, 15-minute visits, 12-minute visits, 20-minute visits. There's just no way to be able to get through everything that we have to talk about. So, but it's really important that just exactly what Sheila said about writing things down and really kind of having an agenda for your appointments, because again, then you are able to get through everything that you want to. As I tell my patients, in all of our visits that I have with them, it's like, I can't remember yesterday. So how on earth is everyone else going to be able to remember all of the things like, oh, I need to talk to them about this. So again, it's that conversation. This is an ongoing conversation. And, make sure that you understand that you're the one driving this conversation. You're the one that is going to be able to be making all of these decisions. You live with this gig 24 hours a day. So it's important that you are empowered to know that you are the one that is making the decisions when you're meeting with all of us.
Yes, I would definitely say that us physicians get the bad rap these days with our 15-minute visits. And, it is, I always struggle with, I usually have somewhere between 20 and 30 minutes. And I am so reliant on people like you, Amy and Sheila, to help me and our patients to figure out how we are going to together as a team make these decisions, because I see my patients one tiny moment in time, and for 15 to 20 minutes every 3 months, 30 minutes every 3 months, I am not home with you. And so I feel like my job is to also at a high level, help everyone figure out, okay, what is the best and safest medication regimen? Is what you're taking safe for you and what's going on? If you are having a side effect, is it something that it's expected or unexpected? And is it something that we can control, is what we call modifiable, meaning, is it something that if we change or, we change something, it could improve, or something not. And so I definitely love, both of what everyone is saying, about, discussing, preparing, and then really, having the patient really be the center of the conversation. Because I tell my patients, I don't go home with you every day. I just need to know what is happening, right? So I love the idea, Sheila, of your notebook. I have some of my patients come and they have put their top 5 questions before they've come in, and I am able to say, and that helps me. So I don't know, if they did I freeze?
I can see you now. Yeah, you're back. You're back.
Oh, sorry. How much did you guys miss?
A little bit.
Okay.
Some important information.
It was great. You guys missed the most important part. Welcome to Zoom. Year. So I think I was just saying I love the prepare, prepare. And we definitely get a bad break because we, in 30 minutes, I just, for us, when we're trying to make decisions about medications, we really need to understand what are like the barriers to taking them. So in terms of talking more about barriers, we've talked about preparing and preparation. How would you guys describe what you've seen as the major barriers to sometimes taking your medications from that light?
Well, personally, with the patients that I work with, I mean, of course, cost is always a big issue, but sometimes it just has to do with, I'm not sure where to get it. Also, sometimes another barrier has a lot to do with, I don't really know what this medicine is doing for me. So, again, really having that conversation about what it is going to do. So those are two big ones that I see. Sheila, how about you?
I agree, just making sure they can afford it, where do they get it? And especially when COVID hit this last year and people have issues with their jobs or not having their jobs, and now just really trying to figure out how to afford their medication. And are there any programs where they can get free medication? So those are the things that I've been seeing recently.
And Amisha, because you've written on this topic of medication, use, what are some of those top, three barriers that you've seen when it comes to people taking their medications?
Yeah, I mean, I think that, so one thing I want to say is one thing that I've been, and I tell my patients too, is that it's not always around the patient too. Some barriers are above their head, even above my head. So, they're not, between our relationship, but could be with insurance, could be with coverage, could be with access. I mean, there are social determinants of health that are sometimes out of people's controls that can really affect what is happening. And so I do always preface like the what people are hearing when we say those things. So I think that in terms of, I think access to medications just in and of itself, right, like true out of pocket cost, that's a major issue that we have to deal with, especially here in the United States. And then I think side effects. And so some things, what I try to do is counsel on this example. If you are on a GLP-1 agonist, we know you're going to have nausea, you're going to have certain side effects in the first, especially up front. And so I think the most important part with side effects is people knowing what to expect. They just want to know and what's normal and what's not normal and when to report it. I think those are some of the top barriers, I think, to being able to engage and I think that I try to be really mindful of it, of saying, there are things out of our control. If anything, COVID-19 era has showed us is that there are so many things about our situations that, that we don't have control over, but there are things we also have control over. And so really trying to figure out that balance of how to do it. And I think taking the extra time to figure out in the visit how to overcome that. I try to make sure, it's really tough sometimes, but that's where the preparation comes in. Because if someone is prepared and I have that volume of time to address all those concerns, I'm not, we're not waiting for 3 months to readdress some of them. We've addressed them and sort of moved forward. So I always say I have this like car mechanic analogy.
Oh no. We're missing her car mechanic analogy. I love it. I love her, that analogy.
How they're taking them and information. when I have all of the preparedness, the medications, the logbook, etc., I sort of say, great, the car is in the shop, I can diagnose it and get ready. But if I don't have that information, the car is not in the shop. So as a mechanic, I can't really do anything. And so I think that's
I will go real quick just to the chat. We had.
Yes, I saw that because
Oh,
I
good.
wanted to.
Go,
I wanted to
go ahead and take that, Amy.
Yeah, no, I wanted to, but I wanted to kind of just say what Amisha was saying is,
Sure.
I mean, certainly that preparation phase is really crucial because there are a lot of steps now to when it comes to coverage of medicines. And the sad reality is that, it does take a lot of time. So, again, I'm fortunate at the University of Chicago. We have a wonderful nursing staff. We have a pharmacist who helps with all of those things. But again, sometimes it's on all of you to really kind of do that legwork of, does this require a prior authorization? So really having that communication with your doctor of, what is the process that I need to understand to be involved in making sure that it keeps going from step to step. But I know, Sherry, thank you for sending this in the chat, that you said a barrier for you is sometimes that you eat on the run and it's inconvenient for you to take it at the right time. That's another really, really crucial kind of jotting down in that notebook of yours to say, doc, nurse practitioner, PA, what do I do? Again, I'm eating on the run. What do I do with my medications? Because, again, there's always a way to do plan B, plan C, plan D. So again, we want to look at all of those options so it fits for you. Because again, that's really important, but great for adding that. Thanks.
I would like to add, in the chat, I think that is a huge thing that I try to tell my patients about, like, what medications can I take with, if I have not eaten anyway, and what medications can I not take, because I need to have them with food. And I think that's a huge, so as if you're coming in to see your doctor, nurse practitioner, your diabetes care and education specialist, definitely get that information. That is a huge knowledge gap, and not all these medications work the same with food. Sheila, do you have more to add?
I think that's great because we even have patients who work different shifts, right? Some are on the night shift, some are on the second shift, and they come in, and that's what we do. So it's so important to write it down because we try to come up with a plan. Okay, let's work this plan. What would work for you? And as Amisha said, writing down, which medications work best with food, which ones work without food, and then trying to figure out in your schedule, what kind of schedule can we help you create? Because again, we're here to support you. And then let's try it to see how it works. And then you can provide that feedback to say, hey, I like that plan. It really works for me. Now I understand it. And yes, I can do that plan. Or as Amy say, have a plan B to say, well, if that one didn't work, let's try plan B. And then you can provide us with that feedback to say, this is the plan that works for me. And we can document that and have it in your chart so that if you're working with other providers, because again, we share information because you are at the center of the care, so that other providers will know what works best with your schedule, especially when they may be adding medications or something. So, yeah.
I definitely think that some of, and also I want to add, we have some newer medications that, something called like SGLT2 inhibitors and GLP-1 agonists that are new, meaning that they've been around for maybe like 5 years or so, and that have benefit to the heart in various ways and weight loss effects. But some of these new medications definitely can also cause side effects. And so we kind of talk about that. And so obviously we all try to talk about side effects and the importance of talking to your doctor about your medications and issues. Sheila and Amy, how do you counsel your patients about how to handle some questions that they have when they are thinking about going on a new medication or continuing on, or maybe even thinking about this medication is not right for me?
I'll let Sheila go first. Go ahead, Sheila.
So again, I try to sit down with them to look at, what are some of the side effects that could occur, right? What would be the best time to take the medication, and then working with them to look at their schedule so that way they can plan their schedule. This is the best, this is how I take my medications now, and this works for me. And then work with them to be able to have that plan to incorporate any new medications so that they're aware. When do you call your provider to let them know? We know that these are some of the side effects, but if they become too much for you to handle, to reach out to your provider, or just so that way they'll be prepared. And I find that patients appreciate that. They'll come back and say, thanks for giving me that information, because when this happened, I was ready and I was prepared and I kind of knew what to do, or I was expecting it in case it happened. And this is what I was able to do. And so those are some of the things that I've been doing when I work with patients. Amy?
I agree with Sheila. Again, it's, trying to prep them. I mean, sometimes, when we think of that kind of that pro-con list of talking about medications, again, I don't always like to bring up all the side effects, because again, I mean, it sometimes puts ideas in our heads, like, oh gosh, I'm going to get them. And then you start feeling icky. But again, I think, giving people that heads up of, all right, this may happen. Again, may not, but again, just so it's normal. For example, metformin, is a medicine that's been around forever, and it's a really good drug, but it can cause a lot of GI upset, and there's ways that we can stop that from happening. Again, that if somebody has a little bit of diarrhea or stomach upset, we could take the medicine at the end of the meal or in the middle of the meal, something called kind of sandwiching. So again, that food will kind of blunt it so it won't affect the stomach as bad. So there are lots of ways that we can work to kind of help minimize some of these side effects too. And to the point of what Sherry mentioned, again, there are some medicines that they don't have to be taken in relation to a meal. So again, knowing those types of things are really, really important. So again, really having a good conversation about all of the medicines. And I'm sure all of you, again, being where we are, and, of course, with COVID, you're watching television, and you could probably have a couple jingles in your head for some of the diabetes medicines. So you're probably coming to your doctors or your nurse practitioner or your diabetes care and education specialist and say, talk to me about that medicine. And so I think that's where, what Amisha was saying is, again, there's all of these new medicines that are out that are wonderful. But again, knowing what they can do to you and if they're right for you is important.
Yeah, one thing that I also want to highlight, I always try to explain to my patients that having a low sugar or having hypoglycemia might not be a side effect per se. So I try to, if someone's exercising and doing everything right and doing, the things to engage and are eating healthier, you can actually, drop your sugar, and it's my job to back off on the medication. And so sometimes I definitely want to say, like, don't think of hypoglycemia or low blood sugar as a side effect. It means the medication is working and we need to adjust the medication, and you need to call us before you stop it, right? So because that means that the medication is working, it's just very strong.
You bring up a really good point, and there's also another great comment in the chat as well, just regarding statin medications. Again, a lot of people, again, we know that those medications help to lower cholesterol, and that's their job. But if you stop taking it after the cholesterol is back into usual range, it's going to cause the cholesterol to go back up again. So, again, we have to understand that some of these medicines that you take are for the long term, because that's what's going to help bring them down. So it's important that people understand that, exactly to what Amisha said, that regardless of if we're talking about blood pressure, if we're talking about cholesterol, if we're talking about blood add sugars. Again, we don't want to look at it in kind of an all or nothing approach. This is about, again, we don't want to eliminate a medicine just because, again, things look better. It's doing its job for you.
Sheila, did you want to add a comment?
No, I think that's great. And I was seeing another comment that was in the chat box about what can they do about the sugar cravings are on high, sweets every day. What can they do to bring those cravings down? They tried other things they don't want to hear about, just staying away and avoiding. I say make a little small changes because I experienced that too, right? Make small changes to try to change what you're actually feeding the body, right? Try having maybe a piece of fruit. Listen, it's not going to happen overnight. And so it's a lifestyle change over time. And pat yourself on the back and support every little success. And what I've said to my patients was, listen, let's write down what those sweets are. What things are calling out your name? What are calling your name saying, listen, Elaine, I need you to come now. I need you to come see me, calling out your name, because we want to have a different type of love affair with our body, right? And that's what I tell people. We have to have a love affair with our heart, our organs, because they've been with us for the rest of all of our lives, and they will be there for us, right? And so we have to make little small changes so that way, once we make those little small changes, they stick with us. So maybe if you see you're craving a lot of chocolate, maybe you can try having a piece of fruit, or maybe you can try having some carrots or a piece of vegetable. Again, it's not going to be easy. It's going to be difficult. But once you start to make those changes, it becomes easier. You'll start getting to the point where you'll crave different things. And so I'm speaking from experience and telling you. And so you'll stop buying those things that you crave so much, and you'll start buying different things. And once you start making those little small changes, they become habit and they stick with you, and you will find that those are the things you want more of. I start having more nuts around me. And so I have a bag of nuts or a container here. I might count out 15 grapes, have some carrots to have a balance. And so you have to make little small changes. And if you write it down, you see it. When you start writing down to see what those habits are and what you're doing, and you're able to see it, then you can say, well, what one thing can I change now and try, and make little steps that you can do to stick with, and you'll see the transformation is going to come. And again, it'll become easy. Amy, I don't know if you have more you want to share.
Okay, well said, Sheila. I'd say eating is a very personal experience. Again, it is the one thing that we have total control over. And so it's very difficult for people to hear from a dietitian. And of course, I'm speaking as a dietitian because I am one. If a dietitian says, no, you can't have that, because what it does is that it just elevates that craving. So one thing that we also have to understand is that, again, it's not about all or nothing. Again, it's really about the how much that we have. So, again, I'm an Oreo fan. I love Oreos. I have 5 bags of Oreos in my refrigerator down here. But again, it's all about, I have 2 of them, so it's really, can you control yourself and only have that much? If you can't, then, again, then that is something that you want to maybe eliminate out of your periphery so you're not tempted. But again, I think that it really does come down to understanding, what it is that you want, and, exactly what, Sheila was talking about, that, having love of yourself, again, eating is supposed to be an enjoyable experience. And if you want to have that craving, and you're going to have that craving. Let's just be honest. You're going to have that craving. If you omit it or deny yourself, it is just going to explode. So we have to find a way to balance those things. And exactly what Sheila said, again, are there other ways that we can kind of circumnavigate that? But I do strongly encourage that you do see a dietitian that is willing willing to work with you, and being totally honest about kind of what it is that you want to accomplish and what it is that you want to continue to have in your meal patterns, because again, that's really important, because we're only on this rock a very short period of time. And so again, we do want to enjoy ourselves. But again, it is about the volume that we have that is going to take us overboard.
Yeah, going back to my car analogy, I always say you got to have the right fuel, right? And sometimes you need to treat yourself to the expensive premier fuel, oil change. Like you need the carrots. You do need some of that, right? And so I think you're exactly right. Like Rome, I would say Rome was not built in a day. And so we just have to take it one day at a time. And I always say, like, okay, what's our goal for the next 3 months? And we'll make 1 or 2 goals, and let's see if we get there. I think you have to take it, like you said, while it can be a very short time on this rock, it's a very long life still. So we have time to work at it, and it ebbs and flows with life. We know that stressors, job stressors and family stressors can really impact that, even the seasons. So I always see, whenever I see someone on my schedule, January, February, everyone's like, I ate too much, I've been bad, I haven't exercised. I'm like, it's Chicago in the winter and you've just gone through the holidays. Of course, So I think that helps everyone, like, oh, everyone you've seen today feels the same way. Like, yes, we're in the summer, you're more active. So I always sort of gear it towards, like, you're going to be less active in the winter. Let's like rev up your activity in the fall and try to think about how you're going to keep it up in the winter, so prepare. So we're rounding out in the last couple of minutes. I definitely want to talk about barriers to filling prescriptions and things people can do. Do you guys want to talk about some things you talk to your patients about in terms of being able to, like, maybe get to the pharmacy or transportation, et cetera?
So now some of the pharmacies are offering that they will deliver your medications to you. Walgreens is doing it, CVS is doing it. You have to leave your credit card on file. And so there are so many options. There are mail-in prescriptions. And some of the, the insurance plans. And so I would have to check with Humana. I don't know it offhand, but some of the insurance plans, they have where their delivery services through certain pharmacies. And so you want to look at those pharmacies to say, well, I can get my prescriptions from here. I know it's covered through my insurance plan, and this pharmacy will deliver the prescription to me. And so you want to look at all those different options and ask the question. Call your pharmacist if you don't know and ask, do you have delivery service? And if yes, how do I get the delivery service? You can call your insurance plan, call the customer service number. There's people there to help you navigate through some of those type of questions.
Yeah.
Amy?
No, great point, Sheila. Make sure also that you're on auto refill. Again, as I said before, again, I can't remember yesterday most of the time, and no, I don't have Alzheimer's, but again, it's, where you have so many things going on, and I know that all of you do too. And again, especially if you're in the majority of people with type 2 diabetes, you may be taking, 6 or more medicines. So it's really important that all of those prescriptions are on auto refill, so you don't have to think about it, because it's always unnerving to look at your bottle like, oh my goodness, I only have 2 left. So again, it's really important that again, make it as easy as possible, and that's just a really easy way for me. I get a text, I get an email, it says, by the way, your prescription, it's time for your refill. So that's a really great way for you to just take that off of your mind.
Yes, and even with that, Amy, when they send you that text, they'll say, hey, you have no more refills. Would you like for us to reach out to your provider? And they do it for you. You don't have to try to call and track the provider down. They do it for you. And when you go to your visit with your provider and they ask, do you need any refills? Have that written down in your notebook. So when you go, you can say, yes, I need refills for this, and this. Check the refills before you go. You don't always have to take the bottles with you, but that's something we want you to jot down in your notebook. Do your page of refills. When you get your medicines, write down when they expire so you'll have that information. And so that kind of helps you stay organized. But we do ask the questions when you come. And if you're not sure, just say, yes, I need refills. It doesn't hurt us to click that button to send a refill prescription to the pharmacist, because if you already have some on file, they're just going to add that to it. And so, yeah, just
No,
that's great information.
no, and also for a lot of organizations, a lot of hospitals now have electronic medical records, and so make sure that you sign up for that. So you can get into My Chart or whatever it is, and never hesitate to always send for medication refills sooner rather than later. Again, but I know that I think all of you have just probably seen the chat that Humana has a pharmacy delivery as well. So that's kind of cool. So if you don't know about that, or you are not taking advantage, definitely make sure that you're just considering that, because again, one more thing that can just be taken off of your mind, so you don't have to worry about it. You have enough going on, and so again, these are great tools to use.
Yeah, and we have a comment in the chat, about finding it helpful to prepare your medications in the morning and the evening. I do tell patients, a case reminder or putting on an alarm to help you remind you when to take your medications can be really helpful. All right, should we move to the question answer?
Sure.
Absolutely.
Awesome. So Rebecca, do you want to take it away?
Sure. I think we have had quite a few questions pop up in the chat box that have been addressed throughout the program. I did just want to quickly mention that the ADA has a lot of resources on our website, diabetes.org, or you can call 1-800-DIABETES. We also have information on insulin help if you need that at insulin/help.org for more information. But we have had some great feedback throughout the conversation and in the chat. I don't know if anybody else has anything else that they would like to add.
Yeah, I'm wondering if anyone wants to add to the chat, any other burning questions. I think, again, that would be awesome to hear from the folks.
Sherry in the chat says, I find it helpful to prepare all my meds in a little AM and PM case once a week.
That's smart.
It's, yeah, very smart.
I think also, I always tell patients, put a sticky note or, whatever it takes to remind you to do it, before your meal, or, sticky note on the fridge if you need to, if it's with food.
No, I agree with you. And I was a patient that I saw yesterday virtually, she's like, all right, I'm just going to go low tech and just put sticky notes everywhere. And that's okay. I mean, we have to acknowledge the fact that, I'm sure all of you have heard, it takes 21 days to make or break a habit. That's actually a lie, again, because it actually takes months to create a habit. So, again, don't be hard on yourself if you try something for a couple of weeks and it doesn't work, because this is for the long haul. But, whether it's, again, having, I think people are kind of a little fatigued with alerts on their phones, but again, you can alert on your phone or put your medication wherever you eat, again, on the table. So then at least it's kind of a nice visual reminder, and then at least you won't forget. But one other really important piece is that, like with everything, again, if we don't do something to perfection or we don't do it 100%, all is not lost. Again, brush yourself off, get up, and, just, move forward. Again, we have to acknowledge that sometimes things happen and we're going to forget, but finding ways that are going to work for you to be able to remember to do things most of the time. Oh, I see a question from Darlene. How many times a year should I meet with a diabetes care and education specialist for assistance with diet? So currently the Medicare Medicaid guidelines allow you to get 2 hours of diabetes education and 2 hours of medical nutrition therapy, which is nutrition education, every year. But a referral is required by your physician to do that. So, again, you can see a total of 4 hours every year to get both diabetes education and nutrition education. So great question.
Another question that
Awesome.
popped up, Amy and Sheila and Dr. Walia. My mother-in-law is insulin dependent and refuses to check her sugar. She just injects twice a day and never checks. How can I convince her to check her sugars? Sheila and Amy?
It's really a hard one. And you have to really work with her to really find out, what are some of her concerns about checking her sugars, right? So we need to figure out, why is it that she don't want to test? It might be because she says it hurts. Maybe and showing her where else she can check. We always talk about the praying hands, right? Where the fingers touch is where the majority of the nerve endings are. So we want to stick ourselves away from the areas that are touching. So when you use the praying hand, and so you want to find out why. Ask those questions, right? Because again, we want to listen to the patient. We want to listen to participants. So let's try to identify why it is that she doesn't want to test. And that would be the first thing that I would do. Have that conversation to find out why she doesn't want to test and how can we help her get through some of those. And that would be the start. What we don't want to do, and I heard Amy say it earlier, we have to stop beating on people that have diabetes. We're always being told what we can't do, but never what we can do. We're always saying, don't do this, don't do that, but we don't hear, well, yeah, do this and do that. And so we have to change the conversation so that the person feels more empowered. And that's what I tell my patients. It's about you. You are the center of this whole plan. You choose what you eat, how much you eat, and how often you eat. You choose if you're taking your medication. You're choosing if you're checking your blood sugars. You're in control. So we want you to stay in control instead of diabetes. And so in order to help you stay in control and not diabetes, what do we need to do to give you the tools to feel more empowered so that you can do this? You are victorious. You are in control. We are here to work with you. So I would say start there and have her talk to someone. And again, I do a pre-diabetes class, and the pre-diabetes class is free. But the information we teach in the pre-diabetes class will help you if you have diabetes, because we teach about healthy eating. We teach about being physically active. And I always tell people, if you don't prevent the disease now, these are the things that you're going to have to deal with later. And so we have those conversations. And so I have an evening session that starts today, and I'll be more than happy to share that Zoom link if anybody wants to join. I have a day session that's at 11 o'clock a.m. on Thursdays, or either at 5:30 p.m. on Thursdays. And so get the information. Go to the ADA website. It's a wealth of information on there that you can get about meal plans and what you can do. Again, if you want a piece of candy and you feel like you need to have it, like Amy said, the more we tell you not to have it, the more you are going to want it, and your brain is going to convince you that you need it because we told you no. And so ask the question to find out what are some of her issues with not testing, and let's start there first.
That's great, Sheila. The other thing I would add is I think that's a time to have a conversation with the physician or the provider about new technologies. We have a conversation in the chat going on about new technologies, specifically continuous glucose monitors that are new, that for certain patients who are at high risk for low blood sugars would be eligible either for something called what we call an intermittent CGM or continuous CGM, and finding out if that's right for you. We also have a comment in the chat in regards to Humana mail order pharmacy being able to get test strips and glucose meters at no cost for members, which is a great benefit. So this is awesome. So I always remind myself to check with your insurance company to see what is preferred, and specific, what specific meters, everything. Sheila and Amy, do you guys have anything else to add in regards to technology?
I think that, every plan is going to be different regarding whether it's covered or not. So, again, I know that there's quite a few commercials now for insulin pumps and continuous glucose monitors. Again, definitely check with your plan to find out, because there's sometimes very specific things that need to be done in order to get them. And again, it might take a little bit of work to actually get them as well.
The other thing I wanted to add, which was my fault, I did not go through this earlier. This webinar is a wellness webinar. So if you have Humana specific questions, feel free to put them in the chat. We may not go over it. We may.
Oh no, we lost her again, but yeah, make sure that you do reach out to Humana, because again, they'll be able to help you with any of your specific plan questions for sure.
And I'm looking up the Zoom link now so that I can put it in there. The class is Thursday night at 5:30, and I'm looking up the link now so that I can put it in the chat.
Thanks, Sheila, because I know I have somebody I want to send there too. But I know I see Milena, sorry, I said your name incorrectly, that your mother doesn't check because she doesn't need to, because she knows. Again, we have a lot of people that have been doing this for a long time that feel like they know it. But again, remember that, glucose measurements are just moments in time. So we don't really know that cause and effect to how things are actually working. So it sometimes is a really good idea to spot check. Because again, we may not always know. And the longer that someone has diabetes, the less likely they're going to be able to have those signals that their body tells them what's really happening. So, again, I'd love to say that she can rely on that, but she may not be able to anymore. Thanks, Melina.
I think I froze again.
I know.
Only one more, only a year. I don't know. But I was just saying that we didn't get a chance to, this is a wellness series. So if you have Humana specific questions, put them in the chat, and someone will get back to you. But we would not address it at this moment. So sorry about that. Anyway, these are awesome questions. We have a few questions about meal planning. Do we want to take that as our last question as we wrap up? Sheila or Amy, one of you want to talk about meal planning?
I know, in 30 seconds or less. I know, I'd say definitely see if you can reach out to a dietitian, because then they can individualize a plan right for you. Again, I mean, the down and dirty is, again, if you're having juices and regular soft drinks, I would ditch those. But then really focusing on not the what, but how much that you have. Take a look at the diabetes.org website. They have a really nice plate method that you can kind of take a look as well. But, that's my 30-second spiel on nutrition. I can go on talking about that for hours, but I won't. Sheila, next.
No, I think that's great information you gave, Amy. So I was trying to put the Zoom link in there, so I wasn't paying 100%, but I go to Amy. I've worked with Amy in the past, and I can tell you, she's just as passionate as you see her today. She's just as committed to her patients and working with them and trying to help them figure it out. And when people ask me, well, what's the diabetic diet? I tell them there is no diabetes diet. Let's work with what you want to eat. There's a healthy eating meal plan, and we want to help you find the choices that you enjoy and help you put together menus that you can follow. Because if we write you something, we don't know what you can afford to buy, right? And you might say, well, I wanted to follow that, but I really couldn't afford to buy it. And sometimes people don't always want to disclose where they are. And so if you say to us, this is what I have at home, we're going to work with you to show you how to make that the best meal possible. Listen, I've had patients say, and I won't hold it, well, I eat those Roman noodles in that packet. And you know what I tell them? Let's add some vegetables to it. Let's add a little meat, some chicken that you have. And now we just made a really good chicken noodle soup. And I break the noodles up in the packets so they're not big noodles. And you can stretch that out. And I had a family who had to go to we sent them to the food pantry, and we connected them with the Chicago Food Depository. And when they had those things, that mother made a nice meal and stretched that meal out. So tell us what you have at home, and we work with you to figure it out.
Yep, absolutely. Well said.
Awesome. And then we have some diabetesfoodhub.org resource in the chat as well. So this has been an amazing conversation, everyone. Thank you so much for joining us.
Bye, everybody. Thanks a million.
Thank you, everybody.
Thank you.